Education is the passport to the future, for tomorrow belongs to those who prepare for it today. Hey guys, I'm your Professor Javon M. H. Presbury, back with another episode of Hey Professor, the show where we talk about everything you wanted to know about allied health, health administration, healthcare management, health information technology, etc., etc. Again, I'm your Professor Javon Presbury. I only actually said that twice because I still haven't really derived a standard way of doing this or like standard things to say. I just kind of say random stuff every time. I don't know if you noticed, like watch 2 of my videos in a row. You'll see I say like random stuff. It's never the same. I'm still figuring it out. Today's episode is going to be about health informatics, basically healthcare data, how it's collected, and some of its uses. It's kind of an overview, just a basic video. We're going to have something more in depth a little bit later. Healthcare data is used for many things, a lot of times by government agencies, to kind of really figure out what kind of things are happening in the area as far as diagnoses and how people are being treated from a healthcare standpoint. The example we're going to cover today, and one of the best ways of healthcare data being gathered, is medical coding. A lot of people don't know that medical coding on the front end is done for billing and reimbursement, and that's an obvious truth. The back end is that all that information is actually data that's being collected as well. Anytime a medical record or a chart is coded, that medical records coder is putting down every diagnosis that patient has, as well as any pertinent family and social histories. Basically, you're going to code why the person is there. You're going to code any treatment that they received while they were there, but you're also going to code things like, family history of smoking, alcoholism, family history of malignancies, those types of things. That kind of data is collected. On a basic level, just to give you an example, you can extrapolate from data that you get from medical coding what types of diseases people have in a surrounding area. You can also extrapolate if there are a lot of collisions in the area, if there are a lot of violent crimes in the area, by the medical coding. How? I've worked at many hospitals, both on-site and remote as a coder, so I can tell you a lot of times when I coded those cases, if the hospital that I worked for was a trauma hospital or was a hospital that, let's say, was in the inner city, that hospital is far more likely to have a high number of cases where the patients are people who suffered violent crimes or were in car accidents, or you can even have people that were burned, stabbed, shot, etc. Said I've coded a lot of trauma cases where people would get in car accidents, coded cases where people would get stabbed, will be shot, those types of things. You can pull important data from that. You can say stabbings are up. You can say shootings are up in the area because of the data that you're gathering. On the flip side of that, I've also worked at hospitals that were more for mom and babies. So basically, you have a hospital that has a large OBGYN presence. You're going to have a lot of pregnancies, you're going to have a lot of babies being born in a hospital. And with that, you can extrapolate, any diseases people may have. You can extrapolate any congenital conditions. And just to show you, there is actually a program called Sparks. I think it's SPARCS. The Sparks program, the entire point of it is to record and register data with regards to congenital malformations or congenital defects in birth. Basically, they're able to track any upticks, downticks, weird rapid swings on if there are children that are being born with birth defects. There are similar programs and there are similar audits and data collections done for, let's say, like the STD population. If there's a rapid upswing in people with chlamydia, people with AIDS, people with HIV, they have that information and they're able to use that to formulate and really make assumptions and make bases in treatment for those communities. A really relevant standpoint is the fact that we just basically got out of a major pandemic, a really worldwide pandemic. They're able to track those things too. When you have a lot of people that are going to the hospital and they have these weird infections, or you have people going to the hospital and they have these conditions that are relatively new, you can track, like say, okay, you know what, SARS is taking off in this population, COVID's taking off in this population. If people are being treated, therefore that data, that information is there. And that data has a wide range of uses. That data has uses, like I said, like they can formulate programs, they can kind of know what kind of communities are affected the worst and hit the hardest by those medical conditions. They could see that an area has a severe upswing in burns, and they can say, okay, maybe we need to create a burn ward for this community to kind of treat, those patients that are being underserved. The truth is, more often than not, when someone is being treated for any kind of health condition, they're going to do so in their community. There are outliers, yes, where people have preferences, but generally, when you're in an emergency or even when you're not going to go vastly outside of your community for treatment. So that data is usable for that community to kind of serve anywhere where you live. They're also able to track the effectiveness of vaccines and medication that may be introduced into a smaller market and see how many patients are working out for the best and how they're faring. Again, guys, this is just Professor Presbury giving you a brief overview, a very, very, very slight introduction to health informatics, how some of that data is pulled, and some of the uses. Again, I'm Professor Presbury. I hope you guys enjoyed the video. Have a good one. Bye-bye. Intelligence is not enough. Intelligence plus character. That is the true goal of education.